When I describe Neighborhealth, I really describe it as a healthcare organization that is compassionate and excellent in the healthcare services that we provide. And I also describe it as an organization that is meeting unmet needs in the community. So we want to be that organization where they can go to no matter their income level, no matter if they have insurance, Medicaid, Medicare, or no insurance at all. We want them to be able to come here and get their healthcare needs met.
The providers, the nurses, administration, we really came to this clinic because it was an opportunity to communicate that compassion that we have received ourselves from God to our patients and really serve them that way. And that medicine would really be in a sense, a ministry for us. We want to communicate to them the same compassion that God would, that's unconditional, and care for them in that way.
About 36% of our patient population does not speak English. We also work very heavily with the refugee population. And what's exciting to me is that no matter what background a patient comes from, no matter what state they're in when they come here, they're treated with that dignity and respect. When you sit in our waiting room, you don't know who is an uninsured patient, you don't know who's a Medicaid patient, you don't know who is a patient that is utilizing Neighborhealth. They have insurance to their company, but they love the quality of service that we give. Everybody's treated exactly the same.
Many of our patients, the only health care they've had in their lives has been here, either because of their economic situation in the States or because of the situation of their country. They didn't ever get health care until they came to America and came to Neighborhealth. We're like part of the family now with many of them. I think that's something that is a very rare privilege for a medical provider, but we have it here. Many of my patients tell me that they would not go anywhere else. They know that they're loved here. And I had a lady the other day, she said, I wouldn't go anywhere else because only at Neighborhealth do all the people love my kids.
The nurses and the doctors, they're wonderful. Like, I felt like they're family, so I'm like, well, I'm going to visit my family for my appointment. That's how it felt. It didn't feel like, oh, we're going to the doctor's office, we're going to sit on this cold table, are you okay? How are you? It was very reassuring to know that they truly do care about you.
I have a lot of patients that before they leave, they're like, this place is really great. I'm gonna tell my friend to come, or I'm gonna tell my husband to come, and actually be able to have them refer people in is the best compliment we ever get, that they're wanting their family and friends to come here too.
We estimate that there are about 125,000 potential uninsured individuals in Wake County. And so taking organizations like Neighborhealth and the health department, combining all of them together, we are able to see about 30,000 people. And so the need is still very much unmet. And so it's really important that we're able to grow as an organization so that we can meet that unmet need. And we want to make sure that we're planning ahead to make sure that those needs are met. It's really due to a group of people at the founding stage of Neighborhealth that took a step out there and trusted a vision and invested in that vision to make it possible for Neighborhealth to open its doors in the first place. And that group of people, plus so many more donors and community partners, have come along with us, and we wouldn't be where we were without them. And so thank you. Thank you for your continued support. Thank you for your continued partnership for yesterday, today, and the future to come.